I am Father George P.A., Director of Holy Family Hospital, and I have been heading this institution since last 8 years. Holy Family Hospital has been a COVID center since first wave, and this year when the second wave struck us, it was something which we never imagined, we never thought that is going to be the disaster which is falling on us. Before we could realize what was happening to the people because of this COVID, the patient flow started coming, unimaginable it was. The numbers increased within few hours and few days. We are 350 bedded hospital, but I had to extend these beds up to 450, plus I had also to attach my healthcare to Surya Hotel. And all these 150 patients I had to manage with additional oxygen cylinders. We managed in the beginning with whatever resources we had. We tried to arrange the extra cylinders, extra beds, extra monitors, extra ventilators, and this all we had to do day and night, running around to arrange the resources. The emergency, which had the capacity of 30 beds, I had 80 patients, sometimes sitting on the chair and receiving the oxygen. That was something which was very painful for us, and every hour we are running around to ensure that there is constant oxygen supply. That crisis was something which was worrying us. We are having sleepless nights to ensure that oxygen is being supplied to our hospital. And those days we really went through a terrible time. And we tried to manage with our whatever limited resources, the teamwork of our COVID warriors, starting with the doctors, the nurses, the support staff, all of them stood together. They never counted the number of hours which they were working. They were working tirelessly, without even food sometimes, without even rest. They were going on saving the lives of people. And that's how we managed, and all of them stood as a team. They really worked hard to save so many lives. And we could see a lot of people desperately coming and pleading to us to get a bed. They were desperately going around pleading for oxygen support, and we tried to give whatever best possible which we could give. During those 2 months, we were facing so many challenges. The first and most important challenge was to arrange beds for the patients, and that was the biggest challenge. And we had to run around overnight, contact our vendors. They were also facing a lot of problems. But one challenge which I could say, that whenever we contacted our vendors, the suppliers, they were ready to help us. And I must also thank, though there were restrictions of vehicle movement because of the lockdown, I must appreciate the support which we got from the government agencies, for example, Delhi Police. They were ready to help me out for the vehicle movements to get these beds anytime they were available. They were ready to help me to arrange the movements for this hospital equipment like monitors, ventilators. They gave a good support. And the next biggest challenge was arrange the oxygen. Though we have a support from this liquid medical oxygen from Linde company, but 150 cylinders we had to arrange, thanks to some of the missionaries, some of these SDMs, the nodal officers assigned by the Delhi government and the central government to ensure that there is no oxygen shortage. Those people coordinated very well, and most of them made sure that when there is a SOS call, we had also at times desperate situations, the oxygen level was going and our reserve was not even for more than 1 or 2 hours. Those situations, whenever we send a SOS call, the government made sure that the oxygen cylinders were issued to us, supplied to us, so we could save a lot of lives through that. And so there are a lot of people came forward to support us, to give us oxygen cylinders, oxygen concentrators, and that's where we could see a lot of PP, private public partnership could take help from, and a lot of came forward to extend their helping hand on this desperate and this disaster situation. So those were days we could realize that this concept of public-private partnership could work very well, because on one hand, we private hospitals where they're struggling to ensure the resources to get support from various people, and on the other hand, government also was trying to join hands with us to give us whatever resources we required. That was a concept, and at the same time, we also could see a lot of NGOs coming forward towards the CSR fund. So far, we have been talking a lot about serving the society, corporate social responsibility, giving to the society back from the point of view of the NGOs and the corporate social responsibility. Those could be executed. Those could be realized in this time of this pandemic, and we also got a lot of support and generous soul people came forward asking us what we needed at that time of pandemic. A lot of contributions we received, a lot of help we received from various people, and this public private partnership is a concept which I feel we could focus on, and we could use it and realize it more, so that God forbid if there be any such further surge of the pandemic or anything, we could always join hands and the efficiently will able to serve the people and able to save a lot of lives through that. And I am also grateful that organizations like Wish Foundation, Nokia, and various other agencies came forward voluntarily. Voluntarily, they came forward. They approached us. They said, "We are ready to help the hospital. We are ready to provide whatever we require." They gave us resources to manage this COVID crisis. They are ready to give us help for oxygen plant. They were ready to give us help for the human resources. They were ready to give us help for oxygen cylinders. And we hope that this model of public-private partnership coming, the NGOs, the funding agencies coming forward to join hands to serve the humanity, serve the society, because people still need a lot of help. People still are under fear. Still, people are struggling to meet their ends. People are struggling to come back to their normal life, and that's where we need to come together as one family, as a government, as a private, as the corporates, and then try to put our resources together and give back to the society what we feel that the need of the hour.